This episode is brought to you by SkinCeuticals, the #1 medical aesthetic skincare brand worldwide and the leader in antioxidant science. To learn more, visit www.skinceuticals.com.
Hello, and welcome to Skincare Confidential, a podcast supporting the Science of Skincare Summit, an annual educational event occurring September 5th through the 7th in Austin, Texas, 2025. My name is Dr. Ted Lain. I am a board-certified dermatologist and your host for today, but I am very excited to present my guest. This is Dr. Mark Lupin. Mark is a dermatologist in Victoria, British Columbia. He is also a clinical instructor at the University of British Columbia and the chief clinical officer at MedSpa Partners, where he is also part of their multi-center clinical trials unit. Although what we are going to talk about today, Mark, is a clinical trial that solely occurred at your site, correct?
Yes, that's correct, Ted. And thank you very much for inviting me.
Oh, Mark, it is my pleasure. Thank you so much for coming on. So the reason that Mark is on with us today is, first of all, he's a world-renowned dermatologist. He's someone that I've known for quite some time, and I'm so happy to have you on with us, Mark, on our skincare podcast. But we're talking about a trial that you performed with SkinCeuticals' new product called P-TIOX, which is a really revolutionary product containing multiple ingredients. So I thought we could first dive into what P-TIOX is and how it works, and then how you used it in your very innovative and, I have to say, gutsy trial. So let's let's start talking about P-TIOX, Mark. What can you tell us about this new product?
Well, yes, thanks, Ted. It was basically came as an innovation when we look at treatments with neuromodulator injections. So, we can treat most areas, but there's some challenging areas such as under the eyes, or what I call smile lines, parenthesis lines sort of around the cheeks and so forth. So they came up with this formulation, which has two neuropeptides. One works at the presynaptic junction and one is postsynaptic. And then there's three other main ingredients, all of which are antioxidants. Three of those ingredients are laminaria extract, which is from brown seaweed, which contains iodine or iodide, which is also an inorganic antioxidant, has polyhydroxy acids, which we know well, and also has some niacinamide. So it's a nice little cocktail. And as you know, it's studies of trying to get topical neurotoxin type moieties into the skin have generally not done so well. So I thought it was also bold that they came up with this formulation.
Yeah. And so just to reiterate, right, it's got two kind of hero ingredients, which are the ingredients that work at the presynaptic junction to prevent acetylcholine from being released, and then at the postsynaptic junction to essentially prevent it from from having any activity. And so you can kind of think about this, especially the presynaptic level, as a topical neurotoxin, can't you? The way it's working on SNAP25 and the snare complex.
Yes, well, actually, that first ingredient, bless you, is acetyl hexapeptide 8, and that's also called argireline, and that's been around for 20 plus years. And if you injected that into the skin, I think you would see sort of a definite change. It basically is mimicking the N-terminal of SNAP25, which we all know is the same molecule that botulinum toxins work with. Mm-hmm. And so it's been around a long time. Whether putting it topically does the same, was part of how this study came about. And the other neuropeptide, which is postsynaptic, like you said, Ted, is called dipeptide diaminobuterol. And interestingly, that's related to venom from the temple viper snake. And it binds to the epsilon subunit of the acetylcholine receptor. So it basically prevents that from being activated.
Yeah. So it's really, it mimics the idea of a neuropeptide. And I think the whole, to me, the reason for this new cream, the P-TIOX, is that it's doing something that we try to do it with neuropeptides already, which is kind of this intradermal skin quality goal to improve very, very fine lines, to improve skin texture, redness, pore size. But it's difficult to do that, right, Mark, with just freehanding intradermal injections of a very small amount of a neurotoxin. It's extremely difficult to do, and it's very difficult to replicate either between yourself and another injector.
Absolutely. I think what you're referring to is the micro droplet
Yes.
technique, which some
Thank
people
you.
call meso Botox or meso. And what's nice about this is patients are applying it, first of all.
Yeah.
And also it's more uniform. So we could do micro droplet, but isn't it nice that you can have something uniform in a topical serum?
Yeah, and it gives you what they call a glass appearance to the skin, which makes a lot of sense, excuse me, as you think about its mechanism of action with these two novel peptides, because it really is kind of calming down the muscle activity of the skin at the very highest levels to give the texture a very, very even appearance. Did you see that in the clinical trials when you were seeing these patients back month after month?
Yes, well, fortunately, I've had the luxury of being able to do meso type Botox injections in the past, so to sort of compare, and you're quite right. There's this sort of radiant glass skin is the term, and we wonder what's the mechanism because it can't just be muscles. Some people think it's a balance between if you reduce the parasympathetic outflow, you allow the sympathetic to do better, which is maybe one reason pore size improves as well.
Okay, interesting. Now, beyond those two, as you've already mentioned, there are a couple of other ingredients there. One of them is a polyhydroxy acid, like you mentioned, a 5% PHA. Now, PHAs are very interesting. Alpha hydroxy acids, they're bionic acids, right? They're huge molecules, and they don't do much exfoliating, but maybe just enough that's all we need for the purpose of this cream.
Yes, well, we can get into the study, but basically, I was, as a dermatologist, you want make sure that whatever serum you have is not peeling, not
Right,
irritating, especially in the delicate areas, and it performs perfectly. So I think it would be more it's more like a gluconolactone rather than a
right.
glycolic, and it
Yeah.
performs very gently that way.
Yeah, yeah, there you go. And then you've got the laminaria, which is a very strong antioxidant, as you mentioned, and the 5% niacinamide, which we know is kind of the gentle giant of ingredients. It can do so many things, including helping repair the barrier. So okay, I feel like we've really dived into the ingredients underlying the use of P-TIOX and how it's so novel a combination. Let's go into your study in particular, Mark. So you took entire faces, right, of females in particular, I believe. Is that right?
Yes, it was actually we had males as well, thank
Oh, you
goodness,
did. Okay.
and it was Fitzpatrick 1 to 6, so all
Okay.
phenotypes.
Okay, great. And you did 40 subjects, right? 40 male and female subjects, 38 to 70 years of age.
Yes,
Correct?
and that
Okay.
which is pretty typical of most practices.
Yeah, right. And you said, okay, look, we're going to give them a treatment of a neurotoxin to their crow's feet and their glabella, which is the glabella is the number 11 between the eyebrows. It's the first area that received an FDA approved indication for Botox, for example. And you're going to treat both crow's feet, both eyes, and the glabella. But otherwise, you're going to split the face in half. And on one half of the face, you'll treat it with the P-TIOX, and on the other half, you'll treat it just with the vehicle. So just essentially with everything except the active ingredients that we mentioned. And patients were to treat that daily. And this was about an 8-week study after the run-in with the pre-treatment. So they really had a good amount of time for us to see the effect of the topical.
Yes, and what was great is they used the topical alone for 2 weeks before the injections.
Mm-hmm.
So we could sort of see, well, was there an early sign or signal? First, tolerability, and two, was there a clinical effect, even before the treatments? And the study did show extremely well tolerated, and also there was an early clinical improvement. And it was a double-blind, randomized controlled study, so I didn't know
Right.
what they were using, and the patients didn't know, and they were often guessing. Even my staff were guessing, and it was pretty hard to know. So I think it was a well done study from that perspective.
Well, and I really think this is a gutsy study because, especially when you're thinking about those fine lines around the eyes, you would imagine that almost all of the improvement would be due to the neurotoxin treatment. I mean, you're literally injecting, 12 plus units of a toxin around the eyes, and you wouldn't think that topically applied neuropeptides would add that much in terms of the appearance of the fine lines around the eyes after a neurotoxin treatment.
You're quite right, and in a way, I was relieved that it wasn't too effective. Like it was extremely effective for what patients were coming in for, which
Yeah,
is lines, wrinkles, gradients, pigmentation, all sorts of things. But I was actually relieved that it didn't. If the effect is to do with the neuropeptides, it seems more like a meso effect.
yeah.
And so for me, that was actually thrilling. I didn't have to worry about eyelid-ptosis or anything additional, or treating muscles you don't want to treat. So it
Well,
was really satisfying.
that's a really good point. So as we kind of look at the efficacy, right? I'm just looking at some of these numbers here where we look at the improvement in lateral canthal lines. So this is mean improvement from baseline, and I'm looking at a graph, and we'll show this on our video. The graph has got lateral canthal lines and glabellar lines looking at day 0, week 2, 4, and 8. And especially as you look at week 8 with the P-TIOX treated side versus the control treated side. And again, both sides were treated with neurotoxin. So we know that they were both treated. But in terms of topically what was being applied, we see that there's a statistically significant difference actually in the mean improvement from baseline in the appearance of those crow's feet or those lateral canthal lines between the side treated with P-TIOX versus the side treated with vehicle or control. Again, amazing.
Yes, and you and I are both clinicians and scientists, so we don't
Yeah.
expect these things really.
Yeah.
And so to see something, there were actually 19 different skin qualities, and actually they all reached P less than 0.05, for statistical uh, substance. So it's actually amazing that it really did add. And patients uh, also want something safe that they can use, or a physician want to recommend something safe around injectable treatments like this. So I
Yeah.
think the fact that it was done not in real life, like sort of a real case type of scenario. Um, yeah, no, I didn't expect these results to be. It was not till afterwards that they shared it with me, and okay, um, it sort of matched an impression that once I was doing better.
Oh, that's incredible. And we see the same on the glabellar lines as well. Again, treated with Botox or with a neurotoxin, we definitely see a difference that's statistically significant at week 8 between the P-TIOX side versus the vehicle side. And then, as you mentioned, as we go through forehead wrinkles, under eye wrinkles, nasal, the bunny lines on the nose, the cheek folds, oral commissures, we see again these areas were not treated with the neurotoxin. These areas were just treated with P-TIOX or the vehicle. But we see very significant differences between the appearance and then global fine lines, 33% change from baseline with the P-TIOX versus 16.5% with the vehicle. So it doubles what essentially a moisturizing vehicle can do. So, gosh, we really see the efficacy of these 5 actives that are working together.
Definitely, interestingly, the two neuropeptides also have antioxidant capabilities. So in a way, we
Ah,
have 5 antioxidants,
yeah.
plus 2 of which are also neuropeptides and maybe conferring a meso type of an effect. The other quality I liked was healthy look, healthy appearance was
Overall
one of the
skin health
attributes.
appearance. Yeah, I
And
see that.
even that was statistically different or improved on the PTOX side.
Yeah, as early as day 0, actually, you see a difference. So again, you had that 2-week run-in where the patients had already split the face and were using P-TIOX versus vehicle, and we see double the number of patients had, or double the number of amount of improvement at day 0 between the two.
Yes, definitely. The other thing, I mean, you might expect this, but uh, bless you, is that pigmentation improved. It could be niacinamide, of course, and some of the other. But we saw pigmentation improve. Patients with sort of slight rosacea tendency tolerated it extremely well. And, they were applying the serum completely around the face, including the eyelids, upper and lower. Like there was just, in fact, we didn't advise them to apply it on their upper eyelids. We said just apply it underneath. But they come back and they've used it everywhere, and no issues from a safety perspective, and extremely well tolerated. So the pigmentation, the skin quality, and this is just a single center study. It was fortunately double blind, randomized, and split face. But as time will tell, how this might fit in, and 40 patients is fantastic, but you obviously need bigger numbers to resonate even more.
Yeah, but seeing that kind of statistical significance, even with 40 patients, is really incredible. So Mark, congratulations on a really well done study. I think the protocol makes a lot of sense, and how it was performed really highlights the efficacy of this product and how it really can be used along with a neurotoxin and amplifies the benefits of a neurotoxin in the treatment areas, but then mimics those effects across the skin surface through that kind of neurotoxin effect, as you mentioned. So congratulations. What a great study.
No, just lucky. Lucky,
Yeah.
but thanks so much for highlighting it.
This episode is brought to you by SkinCeuticals, the #1 medical aesthetic skincare brand worldwide and the leader in antioxidant science. To learn more, visit www.skinceuticals.com.
Listen, we have a few minutes left, and I think that there is, I just learned this about you, Dr. Lupin, that you were a neurologist before you were a dermatologist. So, we're talking about all these neurotoxins and effect on nerves, and here we are speaking to a neurodermatologist.
Well, it goes. I mean, I studied neurology, then dermatology, and then my wife said that's enough.
Yeah.
more or less. And then the other thing is that I'm in Victoria, which is near Vancouver, and studied at UBC Department of Dermatology, and that's sort of the epicenter of where cosmetic use of botulinum toxin or Botox
That's right.
So, and in fact, I was using it in my neurology residency to treat dystonias before I met the Carruthers, Alistair Carruthers, Dr. Carruthers, and then Jean, because Dr. Alistair Carruthers was my one of my teachers as a derm resident. So it was nice to share with him some of my neurology experience, and combined with what they were just discovering serendipitously with the cosmetic side.
Now, when you were using it for neurological purposes, did you also notice a change in the skin? Was this something that many people had said, oh, wow, yeah, I see there's some change, or had you not, it wasn't part of what you were looking for?
Yeah, well, in my case, I was working with focal dystonias,
Okay.
because I'm a musician, I'm a violinist, so I was working with pianists and so yeah, we weren't looking at the skin.
Not looking at the skin at all.
We were just hoping they could still play the piano.
Yeah. Okay. Gotcha.
Yeah.
Okay. And what made you decide dermatology then? Why go into derm?
Well, I love all of medicine. It's pretty hard. I'm sure may have had, maybe you were born to be a dermatologist, but no, I'm a classical violinist, concert violinist. I'm still performing, and actually I love neurology, but it was becoming more interventional. And then dermatology just gives a bit more flexibility to have a continual career with violin, with classical work. So partly it was practical, partly it's I like everything. And, it's ultimately when we can help our patients. That's the ultimate meaning of medicine.
Absolutely. And so you still are performing as a violinist. You still have the time to do that.
Well, barely, but yes, I'm concertmaster of the World Doctors Orchestra, which is based in Berlin, but they do about 4 concerts a year. We're playing at Carnegie Hall this year, in the fall, and it's all for charity, so it's sort of a good feel. And then I study with a well-known violinist called Jascha Heifetz in California, so I'm actually still in touch with his pianist, and so we do violin piano work as well, recitals.
Okay. And okay, so you are a full-time dermatologist. You do research. You're a chief clinical officer of a large group in Canada, and you also are a concert violinist and the concert master for the World Doctors Orchestra. So I'm not going to ask what else you do because that's just going to make me feel bad about myself, actually. So
No. Well, I was going to reverse the table and ask you, tell me about you, but maybe there's not enough time. I'm sure there's lots to, we all have interesting backgrounds.
Yeah, it's interesting, Mark. I did not know the neurology part. I had an idea about the concert violinist just because I've heard you speak about music before with such passion. So I knew you were very involved in music. I wasn't sure at what capacity. And so, if we want to learn more about the World Doctors Orchestra, where would we go to find out more about that?
Well, I think if you just Google World Doctors Orchestra, they have their own dedicated website.
Okay.
And it's actually fantastic because there's over 3,000 members from 60 different countries, and about 100 perform each time, and all the proceeds go to local and international charities. So it's been around for quite a few years,
Okay.
as have I. And they have quite a USA presence. They have an international presence, but they have a USA dedicated section, if you like,
Okay.
which is partly why we tend to play it as well in the United States a fair amount.
Well, listen, congratulations and good luck on your upcoming Carnegie Hall performance. When will that be?
That's in November.
November of 2025.
I don't remember the dates, but
it's okay. We can find it online. World Doctors Orchestra, Dr. Mark Lupin, concertmaster. We'll find it online. Now, Mark, we've only got a couple of minutes left, but I'd like to ask you, just because you really are at the cutting edge of cosmetic dermatology, of aesthetic dermatology, what are you most excited about that you see, in the pipeline, should be approved in the next, couple of years? Is there anything that you see that really is something that scientifically is a breakthrough or otherwise is an iterative improvement that you're ready to start using for your patients?
That's a really good question because there's so many. I mean, people talk about regenerative medicine a lot and exosomes and all this. So I think this concept is good. I would like to see something that's sort of well proven from a safety perspective. But that could be a breakthrough in the sense that if we could have ways to promote the skin to be the best it can be, which we in a way have with antioxidants and retinoids and some of the treatments. Technology-wise, I've been most excited about laser coring, because one of my passions is scar revision, and I think you can do amazing things with that.
Okay, have you been seeing that already in your clinic with the laser coring?
Yes, yeah, definitely, and they're already approved devices, and they're just getting better.
Oh, wonderful. See, okay. There we go, guys. We just learned something about laser coring and, of course, regenerative medicine. We'll keep everyone up to date. There's a lot changing in that. Dr. Lupin, thank you so much for your time and for, again, letting us walk through this study that you did on that SkinCeuticals P-TIOX, along with a neuropeptide. It has neuropeptides.
That's it.
Yeah, along with a Botox-like treatment to even enhance the efficacy of that and to improve the appearance of fine lines as well as skin health and skin beauty across the face. I really appreciate it. Thank you so much for being with us.
Thank you, Ted. It's been a real honor and a pleasure. Thanks so much.
No problem. I am Dr. Ted Lain. You have listened to Skincare Confidential. Please, if you've enjoyed this podcast, subscribe, give us a 5-star rating, and refer us to all of your friends. Thank you so much.
This episode is brought to you by SkinCeuticals, the #1 medical aesthetic skincare brand worldwide and the leader in antioxidant science. To learn more, visit www.skinceuticals.com.